All right, so today we're going to do a deep dive into a really big name in medicine, Adalimumab. You probably know it better by its blockbuster brand name, Humira. For a long, long time, it was one of the best-selling drugs on the planet, and for good reason. It totally changed the game for countless people. But all that power, well, it comes with a price. So let's break it down. How it works, who it helps, and the really serious trade-offs that come with it. Just think about this for a second. What if the one system designed to protect you, your immune system, suddenly got its wires crossed and started attacking you, your own healthy cells, your own tissues? That's the fundamental nightmare of autoimmune disease. And it's the exact battleground where a drug like adalimumab comes in. So what are we actually talking about here? Adalimumab isn't your average pill you can just swallow. Nope. It belongs to a much newer, much more sophisticated class of medicines called biologics, and they work in a completely different way. It's called a biologic, so instead of being cooked up from chemicals in a lab, biologics are actually complex proteins that are grown inside living cells. You gotta think of them less like a simple chemical compound and more like a highly specific, custom-engineered biological tool. And really, the key difference here is all about precision. Traditional drugs, they're often kind of like shotguns, small molecules that have really broad effects, hitting lots of things at once. Biologics, like adalimumab, they're more like sniper rifles. They are large, complex molecules designed like a specific key to fit one and only one lock in the immune system. That makes their action incredibly targeted.
So why on earth would you need a weapon that precise? Well, to get that, we have to understand the problem it's built to solve, an immune system that's basically gone rogue, waging a civil war against the body and creating this state of constant, damaging inflammation. Okay, let's meet the main villain in this story. It's a signaling protein called tumor necrosis factor alpha, or just TNF alpha for short. The best way to think of it is as a tiny messenger that runs around shouting, "Inflammation, now!" to all your cells. And look, in a healthy person, that's a good thing. It's a crucial part of fighting off infections. But in a lot of autoimmune diseases, the body just goes haywire and starts producing way, way too much TNF alpha. That inflammation signal is just constantly blaring, 24/7. And that is what leads to the chronic pain, the swelling, and eventually the serious tissue and joint damage that define these conditions. So if the problem is a signal that's just stuck on full blast, the solution seems pretty straightforward, right? You've got to find a way to turn down the volume. And that is exactly what adalimumab was engineered to do. Here's how it plays out. You've got all this extra TNF alpha flooding the body, screaming for inflammation. Then adalimumab is introduced. Its antibodies are designed to be a perfect match for TNF alpha. They literally hunt it down and grab onto it, effectively putting it in handcuffs. Once it's bound up like that, the TNF alpha molecule is totally blocked. It can no longer plug into the cell receptors and deliver its inflammatory message. The result is, well, it's simple, but it's incredibly profound. By intercepting and blocking all those signals, adalimumab basically hits the mute button on the body's inflammatory alarm. That constant, painful call for inflammation is quieted, and the body's tissues finally get a chance to breathe and start to heal. And here's what's so incredible. Because that one protein, TNF-alpha, is the key troublemaker in so many different autoimmune conditions, blocking it makes adalimumab a super versatile therapy. Just take a look at the range of diseases it's approved to fight. It's a huge deal for several types of inflammatory arthritis, like rheumatoid and psoriatic arthritis. For these, it helps crush the joint pain and swelling, and it can even stop the progression of joint damage in its tracks. But its reach goes way beyond just the joints. It's also used for tough skin conditions like plaque psoriasis and for inflammatory bowel diseases, things like Crohn's and ulcerative colitis, where it works to calm down all that inflammation in the gut. And the list just keeps going. We're talking about juvenile arthritis in kids, a really painful skin condition called hidradenitis suppurativa, and even inflammation that happens inside the eye, which is known as uveitis. It's amazing how broad the impact of this one single mechanism is. Okay, so far this sounds like an absolute miracle drug, right? But, and this is a huge but, you do not interfere with a core component of your immune system without some very serious consequences. The same thing that brings all that relief also creates significant risks. In fact, the risks are so serious that the FDA requires adalimumab to carry what's called a black box warning.
You need to understand, this is the agency's most stringent, most serious warning for any drug. It means there are major risks that have to be weighed very, very carefully.
There are two main warnings in that box. First, by tamping down part of your immune system, the drug seriously increases your risk of developing severe, sometimes even fatal infections. And this includes the risk of waking up dormant infections you might already have, like tuberculosis. Second, there's an increased risk of developing certain kinds of cancers, especially lymphoma.
And beyond those two major black box warnings, there are other big risks to be aware of. Things like the potential for severe allergic reactions, the reactivation of the hepatitis B virus, and even, though it's rare, neurological problems or effects on your blood cell counts. This is exactly why using this medication requires a whole safety checklist. Before anyone starts treatment, doctors have to screen for hidden infections like TB and hepatitis B. And while on the drug, patients absolutely cannot get live vaccines, because with a suppressed immune system, the weakened virus in the vaccine could actually cause a full-blown infection.
So when you put all of this together, the whole story of adalimumab is really one of a profound and very carefully calculated trade-off.
And this really gets to the heart of it. On one hand, you have this absolutely groundbreaking therapy that has literally transformed life for millions of people. But on the other hand, that powerful effect demands constant vigilance and a deep, deep respect for its serious risks.
And it is so essential to remember, this is not a cure. It's a management tool. A powerful one for sure, but its success depends completely on that strong partnership, on rigorous screening, continuous monitoring, and just an open, honest, ongoing conversation between a patient and their doctor about the benefits versus the risks.
And all of this leaves us with a much bigger question, one that goes beyond just this one drug. As our medicine gets more and more powerful, as our ability to tweak the body's most complex systems gets more precise, how do we as a society navigate that constant balancing act between remarkable rewards and truly profound risks? It's a question we're all going to have to face as medicine keeps advancing.